So, there was such a hype. Using testosterone for female sexual dysfunction was the term FSD. It's the end of the 90s, early 2000s. I was around then in urology, and people were either jumping on the bandwagon, seeing what was happening with this or not. And we really thought it was going to be something. I know I dabbled in that area, giving women Testim, right? A little, because there wasn't, to your point, there wasn't anything that was marketed for women. And so we used it off label. And it really fell by the wayside, unfortunately, I think. And they were scared to use it. And I think it's because the FDA didn't back it. What kind of work do you think we need to do, really, to get the FDA to listen to the importance of these hormones so that we can get a commercially available product for women?
Yeah, I think going back to the 90s, I think the testosterone falling off happened for two reasons. Number one, I think we underdosed testosterone. Right? A lot of studies that tried to get through the FDA, it showed great safety, but not great efficacy. And I would argue that we weren't dosing high enough to see efficacy. And then the other thing is we can't take this big umbrella of sexual dysfunction, throw testosterone at it, and expect testosterone to fix all of it, right? Like, testosterone only helps sexual dysfunction when it's a low testosterone issue. So again, it will not fix your relationship. It will not make you want him more. It will not make you resent him less. So like you take sexual dysfunction and you're like, testosterone doesn't always work. And it's like, yeah, obviously, right? Like until you understand the complexities of sexual dysfunction. Same with men. You give men with low erections and low testosterone, you give them testosterone, their erections don't always get better, right? So I always like to say, like, women are not overly complicated. We just don't understand this enough. What we need, it's a fascinating topic because testosterone is a hormone, naturally occurring. You can't patent it. You can patent the way it's delivered, but you can't patent it. What does that mean? That means it's going to require about $1 billion for a pharmaceutical industry to go through the necessary safety studies that the FDA is requiring, again, above and beyond what they've required for a male product. Who's going to pay $1 billion for more years of safety study for basically something that's already generic, just to get it dosed appropriately? So, I mean, I'm stuck in a bind, right? Because I'm like, I want more women to have access. I want doctors to feel comfortable that they don't have to be like, take this gel and dose it at 1/10 the dose, which is like super teeny, right? But if you're just going to put it in a pink box and jack up the price to $400 to pay for your $1 billion study, have we actually helped anybody? And what are we going to need to do to get insurance companies to approve that product? Now, one country in the world has a dosed appropriately testosterone product. That's Australia. That company is coming to they're currently doing studies in the UK. And I have heard they're coming to I got to get them on my podcast, but I have heard they're coming to do studies in America next. So it's coming. But again, for the reasons I said, I'm not sure it's going to be available to everybody. Pink boxes are expensive.